To host this conversation with Dr. Nandini Chakraborty, an experienced consultant psychiatrist who has spent years supporting individuals and communities in their mental health journeys. We are living in a world of rapid change, economic uncertainty, rising living costs, pressures of academic, professional, and social life all create a climate where mental health struggles are becoming more common. Question is, who are the various mental health professionals who are involved in delivering care?
Um, Shobhushachi is very right in that most of the time when I say I'm a psychiatrist, people mistake that for being a psychologist. And the media doesn't do much, media in the terms of movies, serials, documentaries. I never watch a mental health movie or a mental health documentary because it just irritates me. We don't shine torches into people's eyes, and we don't do hypnotherapy as part of general psychiatry. So, a psychiatrist like myself is a doctor who specializes in the mental side of the brain, right? So, neurologists and ourselves both deal with the brain and the nervous system, but whereas neurologists deal with the more physical expressions of what happens with the brain, people having a stroke, people not being able to talk, people not being able to move, something that you can see on a CT scan or an MRI. The psychiatrist deals with the behavioral manifestations of things which go wrong in the brain. That's not to say that our work doesn't have a physical substrate. It just happens at a finer level that most of the time at present, we do not see it on the usual CT scans and MRIs. But obviously, when we are using medication that changes chemicals in the brain, and if that works, it means that we are dealing with behaviors which are caused by neurochemistry, and we are dealing with illnesses which have a firm genetic basis alongside what happens in the environment. So, a psychiatrist is a doctor, in summary. A psychologist is somebody who comes from behavioral sciences from a humanities background. So, they are not doctors, but they have looked at psychology as a behavioral science, arts, humanities angle, and they've gone through their bachelor's, master's, PhDs, and the intervention they offer to patients is only through talking and understanding and analyzing their behavior. They are not diagnosticians. As psychiatrists, we would learn the basics of psychotherapy and the basics of psychology. As a psychologist, a clinical psychologist will learn the basics of the human brain and some neurochemistry. I suppose some courses would include that. And then in this country, we have nurses who are specialized in mental health. We've got social workers who are specialized in mental health. We have occupational therapists who are specialized in mental health. We can have, managers, healthcare social workers. All these streams can have a specialization in mental health, and we work together as a team. Now, when you talk about psychotherapists or counselors, it's very confusing because whilst medical profession is very strongly regulated, very strictly regulated throughout the world, you can't always say that as for counseling. Psychotherapists and clinical psychologists as clinicians will have a certain degree of regulation. But on the net nowadays, sometimes I have a look out of intrigue, and you get a lot of people who claim to be lots of titles, well-being specialists or counselors or, mental health advisors. And what I would say over there is a variety of qualifications, and they are not always accredited or regulated. So if people don't want to see a doctor if they are frightened of a psychiatrist and want to go down what they would see as a gentler route. You need to be careful about the credentials of who you're approaching, especially if it is the result of a Google search on the net.
Yeah,